So here's one common disappointment that a lot of people experience with therapy. And the disappointment comes as a result of expecting that one consultation, one session with a psychiatrist is going to figure out all the things that are wrong with you and tell you how to make them right. This person comes in with expectation that in one session I'll be able to alleviate all of their emotional pain. I'll be able to release all of this pent up anger that they've had for 20 years, 30 years. That I'm going to relieve their anxiety, their depression, their stress in one session. And that's not possible. And so when people come in, they expect that at the end of the session, I'm going to have a diagnosis. And that's also not always likely, because mental health challenges tend to be things that we sit with for a long time before we come to seek treatment. And so it would require time for the psychiatrist or for the therapist to understand what exactly the problem is before they can go on to offer solutions or to offer treatment. And so there's a lot of patience that is required when you're trying to understand yourself more deeply, when you're trying to know yourself more clearly or to define yourself more clearly. There's a lot of time that's required, a lot of work that you need to put in, a lot of effort. And so if you're coming in with this attitude, then you're not likely to be disappointed. But if you're coming in thinking that just seeing a psychiatrist one time is going to fix all my problems, then you are going to be disappointed, and you're going to think that there's something wrong with the process, when really there's something wrong with your attitude towards the process. And so a good therapy session should not relieve you of all your stresses. It should not actually make you better by itself, the therapy. A good therapy session should help you make yourself better, should empower you with the mechanisms that you require to get yourself up. Because if you rely on the therapy session, on talking to the therapist to feel better, then again, you're probably just venting to your therapist. You're not really sorting out your issues. And I'm going to repeat this again. A good therapy session is not supposed to help you feel better. The therapy session itself is not supposed to help you feel better. It actually shouldn't, because then you start developing a dependence on it. And like I said, it's likely that you're venting and not working through the issues, not processing these emotional wounds that you carry. A good therapy session should empower you with the resources that you need, with the tools that you require to be able to repair whatever is broken, to be able to build yourself up again, to be able to get yourself back. That's what a good therapy is supposed to do. So that once you're done, the termination process is seamless then. You transition into complete independence. You're now in charge of your life again until the next time you need a therapist. So whether what you're doing in therapy works out or doesn't work out, it is you who takes the credit and it is you who takes the responsibility. Such that the therapist is not responsible, doesn't take the credit for your success, and doesn't take the responsibility for your failure. So a good therapy session empowers you, uplifts you, gives you all the resources and tools that you need, all the coping mechanisms, all the strategies that are there to help you effectively build yourself up. That's what a good therapy does.